Hi, welcome guys. Since you have reached here, I assume you or some of your loved ones might be having multiple sclerosis. So, I am Dr. Nikhil Panse. By passion and by profession, I am a plastic surgeon, and I have been diagnosed with multiple sclerosis a couple of years back. I have been living well with multiple sclerosis. I have my own issues related to gait balance, so I use a stick while walking long distances. But I have been managing my disease fairly well, living a happy and fruitful life in spite of MS. So, the main things which I follow are lifestyle modifications, diet, exercise, nutritional supports, regular good sleep, pranayam, and so on and so forth. So the purpose of this video is to share, this channel is to share my experience with fellow MS patients so that you can possibly be benefited by my experiences. So as we all know, MS has got a vast spectrum of clinical manifestations. If we go from head to toe, we have got visual disturbances, there can be staccato speech, upper limbs might be involved, lower limbs are commonly involved. In some cases, both upper limbs and lower limbs are involved. There is tingling, numbness, weakness, spasticity. Bowel and bladder are commonly involved. See, MS, I believe, is a very funny disease. There can be incontinence, there can be retention as well. People have weight gain because of immobility related to multiple sclerosis, and they have weight loss because of muscle atrophy. I have had significant weight loss because of multiple sclerosis. So it has got a varied presentation. Then depression is very common in multiple sclerosis. I believe literature says that of all the chronic diseases, multiple sclerosis has got the highest incidence, or it is depression is commonest in patients of multiple sclerosis. Then there can be decrease in libido, there can be erectile dysfunctions, and I think very commonly at the end of the day you feel very tired, fatigued. The most common manifestations of multiple sclerosis, it's fatigue. And at the end of the day, when you are very tired, you are literally dragging your feet while walking, and you just want to just lie down and sleep and sign off for the day. And when you sleep, your legs start moving. I mean, when they need to move, they don't move. And when you try to sleep, there is this restless leg syndrome, very irritating kind of thing. You have MS hugs, tight spasms of the intercostals, making you feel breathless, as if MS is trying to sort of give you some support. So it is a very interesting disease. Now, as a plastic surgeon, I see a variety of patients. Mainly the patients I cater to are burns, trauma, malignancies, congenital deformities like clefts, hypospadias, and so on and so forth. And I must say here that each and every disease, each and every patient has got its own set of difficulties. We have MS, we also have our own set of difficulties. But yes, we have to adapt to them, we have to acclimatize to them. Now, MS, one another peculiarity of multiple sclerosis is the pain factor of it. Now, do you know there are actually 9 types of pain which are associated with multiple sclerosis? We have increased sensitivity in some areas, there is reduced sensation in some areas, and funnily enough, there can be pain. Rather, I have pain in areas where I have a lot of sensation which is decreased. So it is a very interesting and ironic disease with varied manifestations. Each one of us have our own struggles, have our own battles. The interesting and the good thing I believe about multiple sclerosis is that it commonly affects the patients in the younger age group. Now, as young individuals, we are more likely to adapt to the stress and strain of the disease. We are more likely to fight the disease in a much more effective manner than as compared to the pediatric or geriatric age group. So if this disease would have been manifested in the pediatric or geriatric age group, it would have been more difficult for those group of patients to handle multiple sclerosis. So yes, I think this is one of the good points of multiple sclerosis. Another very positive point about multiple sclerosis is that it is a slowly progressive disease. Now, there are various types of multiple sclerosis, as you all might be knowing, but the commonest one is the slow one, the RRMS, the relapsing remitting type of multiple sclerosis, where you have relapses, have a couple of relapses. Every subsequent relapse might lead to some loss of function, and then eventually, gradually, there is increased loss of function, and there are chances that we might land up in a wheelchair. But the good thing, what I am trying to say here, is that it is not an acute disease like one fine day you have MS and on the next day you are in a wheelchair. So we have got adequate amount of time to plan, to fight our disease. And apart from the medications, which I believe, being an allopathic practitioner, are must, we should consult our neurologist and sort of work along with our neurologist to fight this disease. But along with that, I also do believe that lifestyle modification, most notably exercises and diet, have got a major role to play. Especially those patients who have been diagnosed recently, I think regular exercise and diet can sort of modify and alter the course of disease in a positive way. So those who are recently diagnosed, I think they should step up their exercises and modify their diet. Those who have been diagnosed a bit late, a couple of years down the line, like me, who have got postural problems, gait anomalies, and since the spectrum is wide, you can have a lot of manifestations. I think exercise and diet helps to some extent to have your strength back, to regain some of your lost function, to be able to walk better, to be able to walk longer, to build some endurance, and so on and so forth. So the manifestations of exercise, diet, good sleep, breathing, pranayam, as we call in yoga, so all these are not to be neglected. So I think in the background you can see my gym. This is a small terrace gym, 8 by 8 feet or so, where I do my regular exercises. I intend to show what type of exercises I do with support, because I need support to do exercises. It is not quite easy to do without supports. So as we all know, therapy is very costly. Going each and every day to a therapist is going to take a lot of toll on our pockets. So I do my exercises regularly at home with the help of supports. And there are a couple of other things which also I would like to discuss about diet and lifestyle modifications. So I think pain is harder. Pain is also one of the important things which I would like to discuss. How do I manage my pain? How can we all effectively manage our complaints of pain? So pain is difficult. Exercising in spite of pain is even more difficult. It's harder. Not eating our favorite foods like ice cream, processed foods, custards, it's difficult. Eating healthy foods, broccolis, vegetables, that's even tough. But I think we have got a tough road forward. We need to step up our efforts. We need to sort of strategize in a very effective manner to battle our disease. So cheer up, guys. Let's go to war with multiple sclerosis, and stay tuned. I'll be coming up with more episodes, more videos on exercise, diet, nutrition, sharing my experiences. So stay tuned. Cheers.